Welcome to Plastic Art Review. We're going to go through the latest papers on aesthetic plastic surgery of the face and eyelids for this month of March. And the first study we're going to go through is an anatomy study performed by, amongst others, Ian Taylor and Brian Mendelsohn from Australia. And it's really a correlation of the lymphatic anatomy of the lower eyelid and conjunctiva with regards to chemosis after eyelid surgery. And it studies the correlation between the lymphatic anatomy of the lower eyelid and conjunctiva with postoperative chemosis and edema after lower eyelid surgery. Previously to this paper, the most important publication on chemosis and how to avoid it was the one published by Mark Kottner a few years ago. But this really goes much more in depth on the anatomy of the area, and it really comes to similar conclusions in terms of that dissection laterally, both superficial and deep, can disrupt the lymphatic drainage of the conjunctiva and lower eyelid and predispose the patient to a prolonged edema. And definitely we all know this is a real problem in lower eyelid surgery. Prolonged chemosis and swelling has probably decreased the amount of cantoplasty procedures that were performed routinely just recently in every lower eyelid procedure. Many plastic surgeons right now are trying to avoid disrupting excessively the lateral canthus and using very aggressive dissection procedures laterally because of this prolonged edema and chemosis that a lot of times happens when this is done. Now, the second paper that I think is a must-read is a paper signed by Oren Tepper and colleagues. Oren Tepper is probably the person right now in the US that knows most about 3D printing and 3D imaging technology. He has some very nice papers on that topic, and this is a beautiful publication on the history of photography in plastic surgery. It's accompanied by beautiful illustrations and photographs. And I think history and the study of history in our specialty, I think, brings in a lot of value for understanding where we are and where we're going. And this is an excellent revision and beautifully illustrated again, and I think a must-read paper for all plastic surgeons. And moving on to ASJ, there are a couple of papers on facial surgery and eyelid surgery. The first one is signed by Sam Micino and Barry Side, and it's on chin surgery. Barry Side is professor of plastic surgery at NYU, and he's probably the surgeon that's written most papers on the chin in PRS. His series entitled The Chin 1, 2, 3, 4. I think it goes up to 7 are a classic of PRS. I think the first, the Chin Part 1, 2 appeared in 1999. I think Part 3 in 2003. And then in 2007 came the Chin Parts 4, 5, 6, and 7. And I think he even continued up to, the Chin Part 8 and 9 in craniomaxillofacial journals. And so definitely an expert on chin surgery, undoubtedly. So I think this paper is very valuable. It goes through all his experience on the little nuisance and details and little tricks to have good results, and what are the most common problems of chin surgery. So in conclusion, and as a very broad generalization, he advocates the use of the external approach over the transoral approach, and the use of porous implants like MedPor over the use of silicone implants. And that's all for this month of March on aesthetic plastic surgery of the face and eyelids. I hope to see you next month on Plastic Art Review. Thank you very much.